Medicaid costs are a major issue in health care reform. Tonight, Chief Congressional Correspondent Emanuel shows us how one senator thinks he can keep the program from breaking the bank.
A key component in the revised health care reform bill will come from Pennsylvania Republican Senator Toomey, seeking to cap the growth rate of Medicaid spending per beneficiary.
We're going to make sure that as Medicaid continues to grow, it grows at a pace that our economy can actually afford, rather than the out-of-control growth that we have had. And by doing that, we make this program sustainable indefinitely.
Toomey says what happened with Medicaid was mission creep.
When it was first launched, it was a little tiny percentage of Americans. Today, it's over 20% of Americans are on Medicaid.
Robert Moffat from the Heritage Foundation notes its original purpose.
Medicaid was established in 1965 along with Medicare, and the focus of Medicaid was to provide medical assistance primarily to the poor and the indigent. So it was basically designed as a welfare program for the poorest and the most vulnerable members of society.
In 1970, Medicaid was just 1.4% of federal spending. It grew to 3.3% in 1990. Then in 2010, it was up to 7.9%, and the estimate for this year is 9.8% of federal spending. Toomey says a huge expansion happened with Obamacare by including able-bodied working-age adults who don't have children.
We're not disallowing that category, but we are saying if we're going to do this, we've got to ask states to pay their fair share. And if the state says, well, it's not worth it to do that, then that would be their decision. But I think that's an important reform.
Conservative columnist George Will offered this context in the Washington Post, quote, Toomey's provision, however, makes it this century's most significant domestic policy reform. Moffat says over time that should have a huge impact.
At the end of 10 years, there will be a very significant savings to the taxpayer and the program of about $772 billion. But understand this, it's not a result of cuts to the program. The bill doesn't eliminate any category of beneficiaries. It simply changes the growth rate per enrollee cost over time.
While conservatives talk savings, Democrats call them cuts.
There's a slashing of Medicaid by about $770 billion over 10 years. And if you add to that additional cuts to Medicaid proposed by the president's budget, we're now north of $1 trillion of cuts to Medicaid in the next 10 years.
Even before the revised bill has been rolled out, Democrat Senator Maria Cantwell launched this attack, although with a misspelled prop.
I would hope that my colleagues would stop the focus on the capitation of cutting Medicare, because it would throw so many people off of the system.
Toomey says he's trying to restore some fiscal sanity.
It's a very big deal if we take one of the biggest government programs ever and take it from an out-of-control program that's driving deficits and debt and make it an under-control program that can be sustained and can help us right our ship. So I will consider that a big accomplishment.
Toomey says he believes this Medicaid cap could help gain conservative support, a reason to say yes, even if there are other aspects of this revised health care reform plan they do not like. Brett?
Emanuel live on the Hill. Mike, thanks.